Terminologies and surfaces of teeth. The anatomy of teeth is a marvel of intricate design. From the graceful curve of incisors to the sturdy surfaces of molars, each tooth's form is a testament to both functionality and aesthetics. Let us begin with the basic parts of a tooth. The tooth surface is a beautiful continuum of elevations and depressions. Surface is an elaborate folding of enamel and cementum, which can be visualized as the crown and the root. Take an example of an anterior tooth, that is, the maxillary central incisor. Like all teeth, its crown portion is covered with enamel, and the root portion is covered with cementum. The region where the crown and the root meet is referred to as the cervical line, which looks like the infinite loop when seen separately. This is also the region where the enamel and cementum meet, so it is also known as the cemento-enamel junction. The anterior teeth, such as the incisors and canine, have only one root, while the posterior teeth, generally the maxillary first premolars and the molars, have more than one root. In case of a multi-rooted tooth, the portion of the root adjacent to the crown near the cervical region, which remains undivided, is called the root trunk. The area from where the root divides into two or three is referred to as furcation. If there are two roots, it is called bifurcation, as in the maxillary first premolar. And if there are three roots, as in maxillary first molar, it is referred to as trifurcation. The terminal portion of the root is referred to as the apex of the root. It has a small opening called the apical foramen. In order to understand the tooth from the inner aspect, consider a vertical cross section of the same tooth. The crown portion contains the enamel, dentin, and pulp chamber, while the root portion contains the cementum, dentin, and pulp canals from the outer aspect to the inner aspect. The histology of these were covered in detail in our dental histology videos. Now let us learn the various surfaces of a tooth. Imagine the same maxillary central incisor inside the mouth. The surface of the tooth facing the lip is called the labial surface, and the surface that is towards the palate is called the palatal surface. In case of mandibular incisors, it is referred to as the lingual surface, as it is facing towards the tongue. Next are the proximal surfaces. These are the surfaces that face the adjacent teeth in the same dental arch. These include the mesial and the distal surfaces. Consider the midline of the face passing between the two central incisors. The surface of the tooth facing towards the midline is referred to as mesial, while that facing away from the midline is referred to as the distal surface. So how many surfaces have you learnt now? It's 4. So there are 4 surfaces for the incisors and canine: labial, palatal or lingual, mesial, and distal surfaces. But keep this in mind. In case of the anterior teeth, there is a presence of a sharp cutting edge. This is rather referred to as an incisal ridge than an incisal surface. When the tooth is in function, the smooth ridge gets rubbed away to give a flat surface, giving rise to a 5th surface called the incisal surface, which forms a line of contact with the labial surface, called the labial incisal edge, and a line of contact with the lingual surface, called the lingual incisal edge. This concept is true for the incisors. What about the premolars and molars? These teeth are meant to chew food, so they have a large surface on top to crush the food. The posterior teeth have an additional surface that comes in contact with teeth in the opposite arch in occlusion. This is referred to as the occlusal surface. And since these teeth face the cheek instead of the lips, that surface facing the cheek is referred to as buccal surface rather than labial surface. So the surfaces are buccal, lingual or palatal, mesial, distal, and the occlusal surface, making it a total of 5 surfaces for the premolars and molars. Now let me introduce you to another term, aspect. Are labial surface and labial aspect the same? No. A surface is the outermost portion of an object, while an aspect is how an object is viewed from a particular direction. In the upcoming videos, anatomy of each tooth will be explained in detail. It will be described from 5 aspects, such as labial or buccal, lingual or palatal, mesial, distal, incisal or occlusal aspects. Let's also discuss another term, outline. When we view a maxillary central incisor from the labial aspect, we can observe the mesial outline, distal outline, and incisal outline. However, this is not all we see. We are also observing the labial surface itself. While the labial surface appears flat in 2 dimensions, it actually has elevations and depressions that are more apparent from other aspects. If you had a specimen of a maxillary central incisor, you could feel these variations by running your finger over the labial surface. The same is the case when we view the tooth from the lingual or palatal or mesial and distal aspects. Then what would be outlines seen from a mesial or distal aspect of a tooth? In order to answer this, let us turn the tooth to view from either mesial or distal aspect. The outlines seen are labial, lingual, and incisal outlines. Remember, in case of posterior teeth, instead of incisal outline, we would see the occlusal outline. Next, let us understand the term crest of curvature. Imagine an outline of a mountain. Whenever you see a mountain, you notice the peak, with slopes on either side that gradually descend to the ground level. The highest point of the curvature of the hill is called the crest of curvature. As we've discussed, the surface of a tooth is not a straight flat plane. It is curved. This curvature can be inward, forming a fossa, or outward, forming a crest of curvature. To better understand this concept, let's consider an illustration. Imagine a curved line, and we connect its beginning and end with a straight line. If we draw perpendicular lines from the arc to the straight line, we'll notice that the longest perpendicular corresponds to the crest of curvature. While we don't need to perform this mathematical calculation every time, understanding this concept helps us identify the most prominent part of the tooth surface. Let's have a look at 2 examples. One example is the maxillary central incisor. Let's have a look at the distal crest of curvature when we see it from the labial aspect. Let's also have a look at the level. Like described, let's join the beginning and end of the outline. Where is it maximum outward? You will see that the maximum outward curve is seen in the incisal third, cervical to the disto-incisal line angle. We can see the crests of curvature from any surface, but the crest of curvature on the mesial and distal outlines have special names as they come in contact with the adjacent tooth. Hence, they are called contact points. Next, let's take a balloon and gently make it touch a glass plate. What do we see? the most prominent portion of the balloon's surface, that is, the crest of curvature, contacts the glass first. The contact is gentle at a single point. This is called the contact point. Now let's press the balloon a little more against the glass. What do we observe? The balloon adapts to the glass surface and a large circular or oval area comes in contact with the glass. This is called the contact area. The enamel surface of the tooth, although hard, is dynamic in nature. The neighboring tooth surfaces, when in contact, undergo rubbing, referred to as attrition, leading to a larger area in contact with each other. This is called the contact area. The only natural exception is the distal-most teeth of the arch, that is, the third molar, which doesn't have a distal contact. All the other teeth have two contact points, converting to an area over time in the case of optimum occlusion. Let's look at another example. Remember that the crests of curvature of adjacent teeth meet at these contact points. Take, for instance, a right maxillary central and a lateral incisor that are in contact with each other. The distal crest of curvature of the right maxillary central incisor contacts the mesial crest of curvature of the right maxillary lateral incisor. Now, if we observe the area cervical to the contact point, we can appreciate a triangular-shaped space between two adjacent teeth. This is referred to as interproximal spaces. This area is normally occupied by the interdental papilla of the gingiva. The base of the triangle is the alveolar process. The sides of the triangle are the proximal surfaces of the contacting teeth, and the apex of the triangle is in the area of contact. Let's expand this view. When two curved surfaces meet each other, they create triangular spaces all around. For example, if you bring two balloons into contact, you'll notice triangular spaces above, below, in front, and behind the point of contact. Similarly, in the oral cavity, these triangular spaces formed when two teeth are in contact are referred to as embrasures or spillways. These embrasures can be categorized as labial or buccal embrasures, lingual embrasures, and incisal or occlusal embrasures. Their crucial function is to allow food to escape from the chewing surfaces of the teeth. Failure to accurately replicate these embrasures can lead to issues such as food lodgement, causing discomfort for the patient. That was a brief introduction to dental anatomy. Let us revise what was learned from this video through a brief summary. The parts of a tooth are crown, root, cervical line or cemento-enamel junction, root apex, and apical foramen. A multi-rooted tooth contains a root trunk and a furcation. The surfaces of anterior teeth are labial, lingual or palatal, mesial, and distal. The surfaces of a posterior teeth are buccal, lingual or palatal, mesial, distal, and occlusal. The greatest convexity appreciated on either outlines of a tooth when viewed from a particular aspect of the tooth are referred to as the crest of curvature or height of contour. The adjacent teeth in the same arch contacts at the crests of curvatures of mesial and distal outlines. This is referred to as contact points or contact areas. The interproximal spaces between the teeth are triangularly shaped spaces, normally filled by gingival papillae. With that, we come to the end of this video. In the next video, we will be covering how a tooth can be divided into thirds, and we will also discuss line angles and point angles of the teeth.